Hello, welcome to another Orthopod. I'm very privileged to be able to spend a few minutes talking to a friend, a colleague, someone who has taught me more than he probably knows. Professor Shekhar Kumta, who is currently the professor of orthopedics at the Chinese University of Hong Kong, is an assistant dean in the Faculty of Medicine, and also is the executive director in a center for bioethics there. Welcome, Shekhar.
Right. So we are in the business of treating, healing, understanding people. So whatever happens to people, be it COVID, an epidemic, or significant changes in the environment, and the issue in Hong Kong particularly concerns the issue of who controls the Hong Kong legal and human rights situation, which is now under the scrutiny of the mainland. So Hong Kong was a one country, two systems arrangement, and that has been severely curtailed. Now, notwithstanding all these political developments, our fundamental role as physicians primarily is to treat and heal and be responsible for the healthcare of the population. And I think that's where, even though there are major protests that have happened, and through the protests, we have been continuing our services and keeping our focus alive on service, on teaching, which is very important, on continuing research and continuing innovation, because I think eventually it is people that matter, and regardless of where we are, we have to have a very, very broad and humanitarian perspective. And I think that requires good leadership at the medical level. In fact, at all levels, we shouldn't be lost in violence. We shouldn't be taking political sides, although we may have political opinions of our own. But when it comes to major calamities and issues, and I view social disturbances in Hong Kong in the same category as the pandemic. And I think that has taught us many lessons. In fact, we learned our lessons from SARS that, social distancing is quite important. Personal protection is also very important. In fact, that was a major mind shift and a cultural change that SARS introduced. So during these periods of community strife, social disturbances, and the COVID-19, we pretty much were able to maintain almost 75–80% of our service without curtailing. It is just that we had to prioritize and make room for should there be mass casualties when the social disturbances became quite violent. And in the context of the recent pandemic, we were expecting the hospitals might be overwhelmed and we might have run out of space. So I think, again, during the time of SARS, we did some very clever planning, very clever rearrangements. So the hospital was divided into a clean and a potentially contaminated area. Likewise, orthopedic services here were reorganized, and there was a special COVID-19 positive elective surgery set up so that in case there were patients who needed elective surgery but were COVID positive and couldn't wait, they could be operated in one unit. But everywhere else, in fact, because my practice is oncology based, we were able to do all our oncology cases. All of primary trauma care was maintained just as before, and it just needed some manpower reorganization, very, very good training for personal protective equipment, how to use it. And I think what really helped us is the screening process. In fact, anybody who came into hospital was considered COVID positive or exposed unless proven otherwise. So there was a very rigid history taking, very careful assessment of symptoms, checking of temperature, and those who we had the slightest suspicion got a COVID test. And within a short period of time, we were able to get the PCR test, which is very accurate. So all in-hospital patients were able to have a robust diagnostic facility, and that's why I think Hong Kong was blessed in some way, but I think it had prepared itself. All the medical personnel were quite used to being shunted. So we had interns and we had the junior faculty. They were also placed on special COVID duty on backup and standby. So I think we were able to ride the crisis.
Shekhar, I know have done a lot of thinking on the ethics of how we educate and the ethics of the decisions we make. I mean, there is an ethical dilemma now, isn't there, about reopening with the reality that there may be, life lost. And we've seen many countries make that gamble, but saying the economy versus healthcare, right? That's the balance we start seeing and saying we can't let the economy go down, so we'll open up healthcare. You're probably seeing exactly that exact statement happening in Brazil. Brazil has made that statement from the presidential lines that the economy is much more important potentially than lives lost. Has that calculus happened at all in what's happening in Hong Kong area, or have you always been in the mindset that the healthcare will proceed, as such? You mentioned a little bit about the economy staying open, but has there ever been this ethical dilemma?
No, so I'm a bit surprised that. Well, actually, I shouldn't be surprised. It's the level of preparedness that goes with opening an economy, and also the the support and the buy-in from the population. The people who
Right.
are going to be at risk, they themselves have to be. I'll give you an example. It's not at all difficult to convince almost anybody and everybody in Hong Kong to wear a mask. The compliance is, there have been studies in excess of 90%.
Okay.
There is a modeling done by the Hong Kong University of Science and Technology, which said that if you get 80% of the population to wear masks, you flatten the curve and you decrease the number of cases to almost 20%. That was the modeling that they did. There's a good explanation of how they came to that conclusion. So opening up an economy and getting life back to normal requires a lot of preparation. In Hong Kong, that preparation is quite easy because everybody is pretty tolerant of masks. They expect hand hygiene has become the norm. Hand hygiene was always practiced in kindergartens and schools, and every outpatient department had very, very strict hand washing guidelines. In fact, even in the surgical OTs, we were audited for how many minutes we wash our hands and after what procedure. So in the wards, you touch a patient, you have to wash your hands. And I think that culture of first of all, self-protection. Secondly, understanding that if you do not manage risk, you extend that risk to others, and not one person, to many others. And I think that is the ethical principle behind, very clever opening of the economy with good steps of preparation. I don't think it's wise to just open the economy and let people have. It's like it's like a roulette. Whoever gets it gets it. Who doesn't get it, and who gets a mild dose. And I think that's leaving it too much to chance. And I don't think that is ethical. So without doubt, I think there is nothing wrong about opening the economy, because this pandemic has not been generated by the people who are controlling governments in their. That's not their responsibility. It just came in from somewhere, and it is the responsibility of everybody to. It was like saying, there's the weather is not that good. Well, you can die if it is just a little bit colder. It doesn't have to be a cold wave, and it's up to you to take precautions. Why, if you go walking naked without any cold weather protection, of course you're going to get hypothermia. And I think you extend the same principle that you've got to protect yourself, and there are efforts made by governments to provide you masks and provide you. In fact, when masks were running short, I think there was a scramble. Every government was trying to get masks, and eventually, I think masks have been made available all over the world. There hasn't been a shortage of masks for individuals. It's just individuals. Some may not have access to masks, but there are masks available in every major city in every country now, and that's that's for sure. And I think I'm not worried about opening economies. I'm worried about people not preparing the population enough, and not enough education has gone. And I have experience in SARS where I was able to educate 120 families from ethnic minority who didn't know what was happening, and they were housed next to a very big SARS breakout, and they had no idea what SARS was. They didn't speak the language. So I, through a church group, I was able to meet them and educate them about how to use a mask. They never even worn a mask ever.
Right.
So I educated the ladies and the children, and there were no children's masks then, but they still were happy to wear a mask. In fact, it became a bit of a novelty. And none of those 120 families got infected.
Wow.
So I think education goes a long way, and community education. People shouldn't rely only on governments, doctors, community healthcare workers. I mean, all of us can educate the population.
Right. I can't thank you enough. I mean, this is insight that we need, because what we're trying to do is we're trying to understand globally how we can learn from each other's experiences. And so, as usual, Shekhar, you've provided a very thoughtful insights to what's happening in Hong Kong that we, I think, can use and extrapolate to other parts of the world. Thank you so much.
Thank you, Boyd. Wonderful talking to you.